Alright, welcome to the Explainer. Today, we are jumping straight into what is arguably one of the most massive medical rebranding efforts in recent history. I mean, we're talking about a fundamental paradigm shift in medicine here, one that is literally rewriting the rulebook on a condition that's been wildly misunderstood for decades.
170 million. Just let that massive number sink in for a second. That is the estimated number of women worldwide affected by what we've long called Polycystic Ovary Syndrome, or PCOS. To put that into perspective, that's roughly 1 in 8 women globally. And if we just look at the UK, we're talking about over 3.1 million women and girls navigating this. It is incredibly common, but historically, it's been so poorly understood.
So here is the central medical mystery for us today. Why on earth is the medical establishment retiring the name of a condition that affects 170 million people? You don't just erase decades of medical history, toss out the textbooks, and rewrite diagnoses without a profoundly compelling reason.
Section 1. More than just cysts. Beyond the ovaries. For a really long time, there's been this persistent, deeply ingrained, and frankly harmful misconception that this disorder was purely an ovarian fertility issue.
Okay, you've got to hear this because it's honestly wild. Professor Helena Teed, she's a leading endocrinologist and director at the Monash Center for Health Research and Implementation, completely debunks this core myth. She clearly states, what we now know is that there is actually no increase in abnormal cysts on the ovary. That's right, the central defining feature that actually gave the condition its name, it isn't even biologically accurate. When you look at the old understanding versus the new reality, the contrast is stark. The old PCOS label focused heavily on ovaries, cysts, and fertility, but the new reality reveals it's actually a systemic, whole-body metabolic and hormonal disorder. The big takeaway here is that the old name actively harmed patients. By reducing a highly complex, multi-system endocrine disorder down to just a localized reproductive issue, it led to years of misdiagnoses, doctors dismissing serious symptoms, and completely inadequate treatments.
So what's actually happening in the body? Well, it's more like a domino effect rooted in systemic endocrine and metabolic dysfunction. It starts with high insulin levels that literally confuse the ovaries into overproducing testosterone. And that kicks off a whole cascade: irregular menstrual cycles, excess androgens causing severe acne and hair growth, and some really profound mental health impacts. But the part that often got missed, the significant long-term cardiometabolic risks. We're talking about metabolic syndrome and a seriously heightened risk for type 2 diabetes.
Which brings us to the solution. Section 2. Enter PMOS, the new paradigm. The new acronym officially stands for Polyendocrine Metabolic Ovarian Syndrome. And honestly, it's a highly strategic shift. It keeps just enough continuity with PCOS so millions of patients don't get completely lost during the changeover. But critically, it finally rips away that misleading cyst label. It replaces it with terms that actually reflect the biological reality: multi-system fluctuations in hormones, insulin resistance, and overall metabolic health.
And you know what? We're seeing this shift happen in real time. Digital patient resources that millions rely on are already aggressively rebranding. Apps and tools are updating to provide evidence-based information that finally reflects a whole-body approach. The digital infrastructure of women's healthcare is quite literally being rewritten as we speak.
But here's a really fascinating piece of the puzzle: the global focus. The experts didn't just pick PMOS because it's scientifically accurate. They also chose it to be culturally appropriate. By intentionally moving away from specific reproductive terms, which can carry a lot of stigma in certain cultural contexts, they're actively working to ensure a safer, more inclusive diagnostic experience for women all over the world.
Now, if you're thinking this was just a quick rebrand cooked up in a boardroom over the weekend, think again. This started years ago with the stark recognition of just how much harm the cyst label was causing. It culminated in a massive 14-year global consensus process led by Monash University. And the ultimate finish line for full worldwide implementation, the 2028 International Guideline Update.
The sheer scale of this is mind-blowing. Led by Monash University alongside the International PCOS Society and the UK charity Verity, this effort engaged 56 different patient and professional organizations. They managed to pull in over 22,000 survey responses from across 6 continents. In fact, experts have confirmed this is the largest initiative ever undertaken to change the name of a medical condition.
But hey, a change this huge doesn't happen without some friction. Section 3. The Pushback. Advocacy concerns.
We absolutely need to look at this critical perspective from Sasha Adi. She's the executive director of PCOS Challenge, which is the largest PCOS patient advocacy organization in the world. She points out, a change of this scale carries real risks across the ecosystem. This process did not adequately meet that standard. It's a really vital reminder that renaming a medical condition doesn't happen in a vacuum, and there are incredibly valid concerns on the table.
PCOS Challenge makes a really crucial distinction here. They argue there's a massive difference between administrative uptake, things like updating electronic health records or changing classification systems, and actual systemic healthcare reform. Just slapping a new label on the condition doesn't automatically close clinical training gaps. It doesn't magically fix broken referral patterns, and it certainly doesn't align reimbursement structures so patients can afford the care they need.
Let's break down exactly what the advocacy groups are worried about. First, yes, patients have undoubtedly suffered delayed diagnoses, but there isn't definitive proof that the old name was the only reason why. Second, renaming everything risks confusing and disrupting the established support networks that exhausted patients rely on right now. Their bottom line is clear. The real work isn't a terminology update, it's changing how doctors are actually trained, how research gets funded, and how care is paid for.
All right, moving to our final chapter. Section 4, the transition, a 3-year plan. Because regardless of the debate, the medical community has charted a course, and here is how they plan to roll this out globally.
They've structured this as a carefully phased 3-year strategy. Step 1 is launching major international education and awareness campaigns for both doctors and patients. Step 2 focuses on updating global public health communications and literally shifting the parameters of healthcare research. And then Step 3 is the complete official integration of PMOS into the 2028 international guidelines.
At the end of the day, why does any of this matter? What should you take away from all this? Well, the ultimate goal of this entire 14-year process is to empower better care. By finally defining this condition as metabolic, the hope is doctors can connect patients much faster with individualized whole-body treatments. We're talking robust lifestyle management, sleep interventions, and insulin-sensitizing medicines like metformin, treating the whole system, not just a symptom.
So it all comes down to this core tension. Will a new acronym finally bring millions of patients the comprehensive, whole-body care they so desperately deserve? Or, as some advocates fear, is PMOS just a shiny new label pasted over an old, broken healthcare system? I guess the next 3 years of this transition will give us our answer. Keep questioning, keep learning, and thank you so much for joining me for this explainer.